The University Hospital's Birmingham NHS Foundation Trust says it's temporarily suspended kidney transplants due to the critical COVID-19 situation in the city. In a tweet, UHB's renal transplantation team said, due to the critical situation with COVID-19 in our area, we are temporarily suspending our waiting list patients for 14 days and pausing kidney transplantation in Birmingham. Dr. Tuva Amathan is a West Midlands GP and joins us now. Thank you for your time. This must be very distressing for those people who were expecting to have a transplant.
Of course, I think, a transplant is a big thing to go through in the first place, and you must be in quite a on a waiting list, waiting for this for many months sometimes. And in this situation, as Prof said before, it is a big operation to go through. There are lots of things that you need to think about in terms of the patient outcome and having the right things in place after the operation, like an ITU bed, for example. Now, in this climate where we're struggling for ITU beds for COVID patients, now that is a precious resource. And again, it's a decision that probably had to be made very, a tough call to make. But I couldn't confirm whether, how they're doing this, but it's a tough decision that has to be made, and we just have to be mindful and think about how much pressure the hospital must be under to even consider such a decision.
Yes, of course. I mean, they wouldn't never take a decision like this lightly. But what's the advice that you can give to patients and the kind of support you can offer those who are being affected by this?
Now, I guess the advice is to make sure you follow the guidelines. Stay at home, make sure you're washing your hands, make sure you're covering your face, and make sure you're staying 2 meters away and social distancing wherever possible, and you're minimizing your contact, because you're not only protecting yourself by doing everything, taking all the actions, taking the necessary precautions, but you're protecting everyone else, because everything you do, and if you're infected, you have a knock-on effect for someone else, and the R rate, for example, in terms of transmission elsewhere. So every person in the country has a role to play, and we must do all we can to make sure that we're minimizing the possible risk of catching the virus and transmitting it.
What does the wider picture look like across Birmingham then, if this hospital's trust is seeing fit to have to suspend kidney transplants? How does that fit into the bigger picture?
So if you look at these numbers from Tuesday, we know that across the Midlands, there's about 5,500 plus patients that are inpatients purely because of COVID. And, across the nation, we've got about 3,500 on ventilators. Now, what we have to remember is that, it's not just a ventilator as a resource that you require for these patients, but all the staff that go around it. And we've just heard about all the absences from staff because they're isolating because of COVID or because they themselves are unwell. And we have to put that all together, and we are stretched. All hospitals across the nation are at surge capacity and the beds are full, and so that's where we are. We are stretched to the brim.
You have the Pfizer vaccine, I believe, available in your surgery to give to your patients. How is the rollout going? Which category of people are you addressing first at the moment?
So just on the other side of this door, all my colleagues are working flat out and getting all the local population vaccinated within our PCN primary care network to catch as many of our patient cohort as possible. Now, we're working through the joint committee recommendations in terms of the categories, making sure the patients in care homes are covered. And here today, we're vaccinating the elderly and healthcare professionals. How
keen are people to take up the invitations?
There is a mixed image, but I think everyone has understood the requirement and the need for us to protect ourselves by, utilizing this quite an effective vaccine that we have, and make sure that, and I think everyone understands that, all the side effects and things, we've been vaccinating quite a lot of people now. So far, nearly 2.5 million people have received the vaccine. So we know it's safe and we know it's effective. So I think everyone is opening up to the idea. And I think, especially from healthcare staff point of view, I think us being on the front line and accepting that vaccine, having the vaccine, has helped tremendously in getting the general population to take up the vaccine. So I think we're doing a pretty good job, and we're doing, it's one of the first few steps in getting all our population covered, and I think we're doing a good job at that so far. But there's still an awful lot of work to go.
Of course. Just finally, how concerned though are people that the gap between the first dose and the second dose was extended to 3 months?
That's right. Again, I think we have to think about what a difficult situation we're in. We're in a position where we're having to make those tough calls. And then the chief medical officers only made that call because, they've got data to suggest that, the immunity lasts for that long. And we want to get as many people covered with the first vaccine as possible so that we're, again, reducing that R number and making sure that we're minimizing the snowfall from this, the consequences of it for the whole population. So it's a tough call, but I think it's the right call.
Dr. Tuva Amathan from GP Surgery in the West Midlands, thank you very much for talking to us.
Thank you.